Why is public health controversial? Welcome back, everyone. In Chapter 1, we explored how public health has quietly shaped modern life, extending life expectancy, preventing disease, and protecting entire communities. But today, we turn to a more provocative question. If public health saves lives and promotes well-being, why is it so often met with resistance? In this chapter, we'll unpack why public health, despite its life-saving mission, is frequently caught in the crossfire of politics, economics, personal freedom, and moral values. Introduction: the nature of controversy. The answer lies in the fundamental balance between science, societal values, and politics. Public health, by its very nature, often challenges the status quo and asks for collective action, which can touch on sensitive areas of economics, personal freedoms, and deeply held moral beliefs. This intersection is precisely why public health initiatives frequently spark controversy over money, liberty, morality, and power. Section 1. The broad mission, root of controversy. Public health's mission is incredibly bold and far-reaching. It's about fulfilling society's interest in assuring the conditions in which people can be healthy. This means public health often tackles issues that extend far beyond traditional clinics and hospitals. We're talking about fundamental factors like economic status, housing, education, and environmental quality, which are the most significant determinants of health. Historically, U.S. public health was closely tied to social reform movements, campaigning for improved housing, child labor abolition, and sanitation. This expansive view, which includes the development of the social machinery for health, leads many to view public health as a movement for social justice. But herein lies the problem. The broader the mission, the more likely it is to touch sensitive areas, economics, personal freedoms, and moral beliefs. Section 2. 3 core sources of controversy. Chapter 2 identifies 3 primary categories that repeatedly emerge in debates over public health actions, making them highly controversial. These are: first, economic impact; second, issues around individual liberty; and third, moral and religious opposition. Let's take a closer look at each. Section 3. Economic impact. Most public health measures, by their nature, have some kind of negative economic impact on a segment of the population or an industry. For example, regulating the tobacco industry, though crucial for public health, affects jobs and profits in tobacco-growing states and businesses. Historically, industries have resisted changes like milk pasteurization, stricter building codes, or design improvements for automobile safety. A key challenge is that those who bear the costs, like industries facing new regulations, are often not the direct beneficiaries, while the long-term benefits are diffused across the population. This friction is particularly visible when the economic losers are powerful lobby groups. Furthermore, putting a dollar value on life and health is incredibly difficult, and in times of economic hardship, people are often unwilling to pay short-term costs for long-term health benefits, even when those benefits are substantial. Section 4. Individual liberty. In the United States, individual liberty is a deeply cherished value, enshrined in the Constitution's call to promote the general welfare. Yet, this often clashes with public health goals. While there's general agreement on restricting actions that directly harm others, like murder or assault, the issues become highly controversial when the harm is less direct or to oneself. This tension is encapsulated by Garrett Hardin's concept of the tragedy of the commons, where individuals, acting solely in their own self-interest, deplete shared resources, ultimately harming everyone. Public health argues that government action is required to protect our shared commons, like air and water, even if it means limiting freedom to pollute. The most controversial measures are those labeled as paternalism, where government restricts individual freedom for that individual's own health and safety, such as mandatory seatbelt or helmet laws. Libertarians, following John Stuart Mill, famously argue that power can only be rightfully exercised over someone against their will, to prevent harm to others. However, public health advocates argue that for behaviors common in the population, Even small individual risks, when multiplied, lead to significant collective harm, outweighing minor inconveniences. This aligns with public health's pursuit of social justice. Section 5. Moral and religious opposition. Some of the most intense controversies in public health arise from moral and religious opposition, especially when confronting sexual and reproductive issues. Major public health problems like AIDS, other sexually transmitted diseases, and teenage pregnancy lead public health to advocate for evidence-based interventions like sex education in schools and access to contraceptive services. However, these measures are often vigorously opposed by religious groups who believe they promote immoral behavior. Similarly, providing clean needles to drug addicts, despite its proven effectiveness in reducing disease spread, is criticized as condoning drug use. While a safest lifestyle might be abstinence, experience has long shown that preaching morality has limited efficacy in preventing these health issues. Furthermore, trying to legislate morality has often proven to be ineffective, self-defeating, and a threat to liberty, in part because people differ on what they view as moral. This tension means public health officials, including former U.S. Surgeons General, have faced significant political pressure and even been blocked from publicly discussing scientifically supported policies. Section 6. Political interference with science. Public health is fundamentally built on science. Therefore, decisions about public health policy should be informed by scientific evidence to the greatest extent possible. However, a significant and concerning source of controversy is political interference with science. We've seen instances where scientific evidence is manipulated, distorted, or suppressed to fit a political agenda, often favoring specific constituencies or industries. A notable case was the EPA's proposed scientific transparency rule, which would limit the scientific studies considered in policymaking to only those with publicly available underlying data, potentially excluding vast amounts of relevant research, including studies using private medical records. The scientific community widely condemned this, with one expert describing it as politics going to a place that should be off limits. When politics overrides science, public health suffers, and so do the people it aims to protect. Section 7. Social justice in public health. At its most idealistic, public health is fundamentally a social justice movement. It's a campaign to maximize health for everyone in the population, distributing benefits and responsibilities in an equitable way. This vision directly challenges what philosopher Dan Beauchamp called market justice, an ideology that emphasizes individual responsibility and minimal obligation to the common good. Social justice, in contrast, suggests that basic human needs like minimal income, housing, education, and healthcare should be seen as fundamental rights. This vision of public health demands collective action, asks society to invest in the poor, and often requires regulating powerful industries, pushing beyond a purely individualistic view of responsibility. As such, health becomes a political endeavor as much as, or at times even more than, a medical one. Not everyone agrees with this expansive vision, and that's precisely why public health is political by its very nature. Conclusion. The essential controversy. So, why is public health controversial? Because it lives at the complex intersection of science, politics, individual freedom, and deeply held societal values. It asks hard questions, makes people uncomfortable, and often demands collective action in a culture that frequently prioritizes individual choice. It means balancing immediate economic concerns with long-term public well-being, individual liberties with collective safety, and evidence with deeply ingrained moral beliefs. And tragically, it can be undermined by political interference. And yet, despite these inherent challenges and the controversies they spark, public health remains absolutely essential. It saves lives, protects the vulnerable, and builds healthier, more resilient communities. The controversy isn't a flaw, it's an intrinsic part of the process. Because doing what's right for the public's health doesn't always win a popularity contest, but it is precisely what makes public health indispensable.